My name is Juliana Flam, and I am doing a case study on Margaret. Margaret is a 32-year-old woman who was given generalized anxiety as the reason for a referral by the doctor. Her symptoms began about a year ago while she was out shopping, which seems to be the common trigger for her symptoms. She experienced nervousness and panic. These experiences continued and worsened over the weeks each time she would go out shopping. Her heartbeat elevated. She felt as though she would pass out. She experienced breathlessness, nausea, and she would burst into tears for no reason. These experiences not only caused her great distress in the moment, but she felt dread before going out and thus developed avoidance habits as well as escape habits in the moments of anxiety and panic. She also experienced shame and embarrassment during the fact and after the fact. However, Margaret desires to overcome her anxiety and is motivated for therapy, reading up on her symptoms, and practicing techniques she has learned to face her anxiety. Just over a week ago, she was able to talk herself out of her panic and resume her shopping after just 10 minutes because of something that she had read before on the internet. It is likely that Margaret suffers from social anxiety disorder. This disorder includes persistent intense fear and avoidance of social situations. In Margaret's case, this is avoiding the supermarket. Other symptoms include fear of negative evaluation or scrutiny by others, anxiety about being humiliated or embarrassed socially, unrealistic negative beliefs about consequences of behaviors, negative self-evaluation, and these symptoms must last at least 6 months. Margaret shows signs of all these symptoms, and her year-long struggle is definitely long enough to qualify. She has expressed embarrassment, and through her talking, she has revealed negative beliefs about herself and her fear of scrutiny by others. In addition, women are twice as likely as men to have anxiety disorders, including social anxiety disorder. Socialized anxiety disorder is often characterized by Mauer's two-factor model, a result of conditioning, which is reinforced by avoidance of the anxiety-producing stimuli. In this disorder, the biological symptoms and cognitive factors work together with a disabling effect. In Margaret's case, she has not only been conditioning her anxiety by escaping every time she goes to the supermarket, but she is also reinforcing it by avoiding going to the supermarket altogether when she is extremely stressed out before ever heading out. She is additionally reinforcing this anxiety every time she chooses not to go and to stay home simply because she is stressed about going. Since Margaret is self-motivated to overcome her anxiety, continued therapy and additional self-help guides should be helpful tools for her. Other options include keeping a record of negative thoughts, their frequency, duration, and intensity, then reviewing this record with her therapist, going over it, understanding why she feels this way, how long she feels it, how intensely she feels it, and how she can change these thought patterns. She would benefit from focused breathing and positive self-talk in anxiety-provoking situations, rather than negatively bringing herself down and calling herself stupid every time this attack happens. Once she has mastered these, it would be helpful if she went to the supermarket every day until she saw the symptoms lessen and eventually fall into extinction. However, Margaret needs to be warned that she must not abandon these trips midway through, as the avoidance and escape may only enforce her symptoms further and thus aggravate her diagnosis, making it much worse. Margaret has a good chance for recovery, as she has shown great motivation and courage already in trying to face her anxiety. If she continues in this way, Margaret shows great promise of recovery.